Have you ever had a bad cough and wondered, is it just a cold or something more like bronchitis? And most importantly, can I give it to someone else? Today, we're breaking down the big question. Is bronchitis contagious? Welcome back to Aged and Health Explained. Here we make medical topics simple and easy to understand. If you find this video helpful, don't forget to like, subscribe, and share. It really helps the channel grow. Bronchitis is when the airways in your lungs, called the bronchi, become inflamed. That inflammation usually causes a persistent cough, mucus, or phlegm, wheezing, or chest tightness, and sometimes fatigue or a mild fever. There are actually two kinds of bronchitis. Acute bronchitis is short-term and usually triggered by a virus like the cold or flu. Chronic bronchitis is long-term, often caused by smoking or lung conditions such as COPD. When people ask if bronchitis is contagious, they usually mean acute bronchitis. So, is it contagious? The answer is yes and no. Acute bronchitis is usually caused by viruses, and those viruses are contagious. You can spread them by coughing, sneezing, or even touching surfaces. But the actual inflammation in your lungs, that part isn't contagious. So if you have acute bronchitis, you can pass on the virus that caused it, but not the condition itself. Bronchitis-causing viruses spread the same way as colds and flu. Through droplets in the air when you cough or sneeze, close contact with others, or touching contaminated surfaces and then your face. If you or someone around you has bronchitis, here's how to cut the risk. Wash your hands regularly. Cover coughs and sneezes. Wear a mask if you're coughing a lot. And stay home and rest until you're feeling better. Most cases of acute bronchitis go away in a couple of weeks, but you should see a doctor if your cough lasts longer than 3 weeks. You cough up blood, have a high fever, or if you have trouble breathing,